Inflammation. Definition. Purpose. Inflammation is the protective response of body tissues to harmful stimuli such as infection, toxins, or injury. It serves several important purposes: elimination of the harmful agent, e.g., bacteria, irritants, removal of necrotic, dead cells and tissues, initiation of repair to restore normal tissue function. Types of inflammation. Acute inflammation has a rapid onset and is of short duration, characterized by the classic signs of redness, swelling, heat, calor, and pain. Mainly involves neutrophils, first-line immune cells. Chronic inflammation, persistent, long-lasting response, weeks, months, or years. Involves lymphocytes and macrophages. Often associated with ongoing tissue damage and attempts at healing, fibrosis, scarring, angiogenesis. Causes. Etiology. Inflammation can be triggered by several factors: infections, bacteria, viruses, fungi, parasites, physical agents, trauma, radiation, burns, extreme temperatures, chemical agents, toxins, irritants, corrosives, immune reactions, allergies, autoimmune disorders, hypersensitivity reactions. Necrotic tissue. Dead or dying tissue can itself trigger inflammation. Cellular events. Process. Vasodilation. Blood vessels widen, causing redness and heat. Increased vascular permeability. Plasma and proteins leak out, leading to swelling, edema. Leukocyte transmigration. Chemotaxis. Immune cells migrate to the site of injury or infection to attack harmful agents. Chemical mediators of inflammation. These are substances that orchestrate the inflammatory response. Vasoactive amines, histamine and serotonin, cause vasodilation, increased permeability. Cytokines. Chemokines, TNF, IL-1, IL-6, promote fever, recruit immune cells, stimulate repair. Nitric oxide, NO, reactive oxygen species, ROS, destroy pathogens but may also damage tissue. Arachidonic acid metabolites, prostaglandins, cause fever, pain. Leukotrienes, attract immune cells. Morphologic patterns of acute inflammation. Serous inflammation, watery fluid, as seen in blisters. Fibrinous inflammation, fibrin deposits, often on linings of organs, e.g., pericarditis. Suppurative, purulent inflammation, pus formation due to neutrophil activity, e.g., abscess. Chronic inflammation, mononuclear cell infiltration, macrophages, lymphocytes, plasma cells. Tissue destruction due to ongoing immune response, attempts at healing, fibrosis, scarring, angiogenesis. May result in granulomatous inflammation, formation of granulomas, e.g., in tuberculosis. Outcomes of inflammation: resolution, complete restoration of normal tissue structure and function. Healing by fibrosis, scar formation, occurs when tissue cannot regenerate. Progression to chronic inflammation, if the cause persists or acute inflammation fails to resolve.